Here is something most dentists never tell you at your appointment. After the age of 50, your saliva production drops by up to 40%. That may sound like a minor inconvenience, but saliva is not just moisture. It is your mouth's built-in defense shield, constantly washing away acid, neutralizing bacteria, and delivering the minerals your enamel needs to repair itself every single day. When that shield weakens, a process called silent demineralization begins, quietly dissolving your teeth from the inside out, long before any pain or visible damage appears. And here is where it gets alarming. Most people respond by brushing harder, switching toothpaste, or visiting the dentist for surface treatments. But if the root cause is internal mineral loss, treating only the outside is like mopping the floor while the pipe is still leaking. In today's video, I am going to walk you through 6 natural remedies ranked from least to most powerful, ending with a 3-nutrient combination that actually activates your body's own repair mechanism from within. Before we begin, drop a comment below, telling me your age, where you are watching from, and whether you are dealing with gum recession, cavities, or tooth sensitivity. I personally read every comment and will reply to your questions. The shortest path to rebuilding your teeth from the inside out. Now that you understand what is silently working against your teeth every single day, let me give you the clearest, most practical roadmap I have found. These 6 remedies are ranked from the lowest to the highest impact, and I want you to pay close attention to how they build on each other, because by the time we reach number 6, you will understand something that most people, and even most dentists, never connect together. Number 1, coconut oil and clove rinse. Let us start at the bottom of the list, not because this remedy is useless, but because it is important you understand exactly where it stops working. The active compound in clove is eugenol, a naturally occurring phenolic compound with documented antimicrobial and mild analgesic properties. Eugenol works by disrupting the cell membranes of oral bacteria, making it harder for them to survive on the surface of your gums and teeth. Coconut oil, meanwhile, contains lauric acid, which binds to bacterial membranes and helps pull them away from the tooth surface during the swishing motion, a process sometimes called oil pulling. To prepare this rinse, warm 1 tablespoon of raw coconut oil and add 2 drops of pure clove essential oil. Swish the mixture slowly around your mouth for 5 to 10 minutes, ideally in the morning, before eating or drinking anything. Then spit it into a trash bin rather than the sink, since coconut oil can solidify and block pipes over time. The honest limitation here is this. A review published in the Journal of Traditional and Complementary Medicine confirmed that eugenol reduces surface bacterial load effectively, but it cannot penetrate below the gum line into the deeper periodontal pockets, where the most destructive bacteria actually live. That is why this remedy earns a 2 out of 10 on our scale. It provides surface relief and can reduce morning mouth bacteria, but it is not reaching the source of gum recession or early enamel breakdown. Think of it as sweeping your doorstep while the damage is happening inside the walls. Number 2, Xylitol mouth rinse before sleep. This one is smarter than it looks, and the timing is everything. Xylitol is a natural sugar alcohol derived from birch trees and corn husks. The key active mechanism is deceptively simple. The primary cavity-causing bacteria in your mouth, Streptococcus mutans, absorbs xylitol the same way it would absorb regular sugar, but it cannot metabolize or ferment it. The bacteria essentially starve. Over repeated exposure, research shows that Streptococcus mutans populations in the mouth drop significantly. And because these bacteria become less effective at producing the sticky biofilm that holds plaque together, they also lose their ability to adhere to enamel. The reason timing matters so much is that saliva production, your mouth's natural cleaning system, drops to its lowest point during sleep. An 8-hour window with a dry mouth and no saliva protection is exactly when bacteria multiply fastest and acid damage accelerates. Using xylitol right before bed places a protective barrier precisely when you need it most. Dissolve 1 teaspoon of xylitol crystals in a small amount of warm water. Swish for 60 seconds, then simply let it sit without rinsing. Do not eat or drink anything afterward. A clinical trial published in Carey's research found that consistent xylitol use reduced cavity incidence by up to 58% over a 2-year period in adults with high cavity risk. For older adults whose saliva production has already declined, this overnight protection is one of the most accessible upgrades you can make tonight. Number 3. Warm salt water and turmeric rinse. Now we are moving into genuinely therapeutic territory. Turmeric's active compound is curcumin, a polyphenol with well-documented anti-inflammatory properties at the cellular level. When it comes to oral health specifically, curcumin inhibits the production of pro-inflammatory cytokines, particularly interleukin-1 beta and tumor necrosis factor alpha, which are the same signaling molecules responsible for driving gum tissue breakdown and bone loss around the tooth root. Salt water, on the other hand, creates an alkaline oral environment with a pH above 7. 4, which is hostile to the acid-producing bacteria that erode enamel and inflame gum tissue. A 2016 study published in the Journal of Indian Society of Periodontology compared a curcumin-based mouth rinse to a standard chlorhexidine rinse in patients with gingivitis. After 3 weeks, the curcumin group showed a 32% reduction in gingival inflammation scores, comparable to the prescription option, but without the side effects of taste disruption or staining that chlorhexidine often causes. To prepare this rinse, dissolve half a teaspoon of natural salt and a 1/4 teaspoon of turmeric powder in a cup of warm water. Stir well until the turmeric is fully suspended. Use this as a rinse in the afternoon or early evening, swishing for about 90 seconds before spitting. A small tip for older viewers. Use this over a sink lined with paper towels, since turmeric can stain porcelain surfaces if left to sit. Number 4. Green tea and raw honey mouth soak. The jump from number 3 to number 4 is significant, and here is the reason why. Green tea contains a catechin called epigallocatechin gallati, commonly written as EGCG. This compound does something remarkably specific. It blocks the protein receptors that Streptococcus mutans uses to physically anchor itself to your enamel surface. No anchorage means no biofilm, and no biofilm means no acid production in concentrated pockets. Raw honey, when it is unprocessed and unpasteurized, contains an enzyme called glucose oxidase that reacts with moisture in your mouth to produce small, controlled amounts of hydrogen peroxide. This creates a natural antibacterial effect, without the harshness of commercial whitening products. A study published in the Archives of Oral Biology found that EGCG inhibited the adherence of oral bacteria to hydroxyapatite, the mineral structure of enamel, by up to 67% in laboratory conditions. Brew 1 cup of strong green tea and allow it to cool to a comfortable warm temperature. Add 1 teaspoon of genuine raw honey and stir gently. Hold a small amount in your mouth for 30 to 45 seconds. Let it wash around your gums slowly, then spit. Use this in the afternoon as a companion to your turmeric rinse, or as a standalone practice. Avoid using this if you prefer to rotate remedies daily. Either approach works, but consistency matters far more than perfection. Number 5. Nano-Hydroxyapatite toothpaste. This is where the science becomes genuinely exciting, and it is the remedy most people have never heard of, despite it being available for decades in Japan. Hydroxyapatite is not an additive or a coating. It is the actual mineral that makes up 97% of your tooth enamel, and approximately 70% of your bone structure. When enamel is damaged through acid erosion or demineralization, it develops microscopic fractures and voids at the crystal level. Nano-hydroxyapatite particles, because of their size in the 20 to 80 nanometer range, are small enough to physically deposit into those voids and integrate with the remaining enamel structure. This is not a surface treatment, it is structural repair at the material level. A study published in the Journal of Clinical Dentistry found that Nano-Hydroxyapatite toothpaste increased enamel mineral density by 42% after 8 weeks of twice-daily use, outperforming fluoride toothpaste in remineralization depth in the same trial. Apply a pea-sized amount to your toothbrush and brush gently for 2 minutes using circular motions. The most important step comes after brushing. Do not rinse your mouth with water. Spit out the excess, but allow the remaining paste to sit on your teeth and absorb overnight. Rinsing immediately removes the active particles before they have time to integrate into your enamel. Brush with this every evening as your final oral care step before sleep. Number 6. Vitamin D, 3 plus K2 plus magnesium. Everything we have covered so far works on your mouth directly. This final remedy works on your body's entire mineral system, and that is why nothing else on this list comes close to its long-term impact. Vitamin D3 is the form your body actually absorbs. Its primary role in this context is to activate the intestinal proteins that pull calcium out of your food and into your bloodstream. Without adequate D3, the calcium you eat, no matter how much dairy or leafy greens you consume, largely passes through unabsorbed. The National Institutes of Health has reported that an estimated 42% of American adults are clinically deficient in vitamin D, and that rate climbs significantly in adults over the age of 60. But here is what most people miss entirely. Calcium that enters your bloodstream needs to be directed somewhere, and without vitamin K2 in its MK7 form, that calcium has no clear destination. K2 activates two proteins, osteocalcin, which draws calcium specifically into bone and tooth structure, and matrix GLA protein, which simultaneously prevents calcium from depositing inside arterial walls. This is the mechanism that makes the D3 and K2 combination so powerful and so different from simply taking a calcium supplement alone. Magnesium completes the trio by activating the enzyme responsible for converting vitamin D3 into its usable hormonal form inside your body. A 2018 study published in the American Journal of Clinical Nutrition found that individuals with adequate magnesium levels showed 30% greater vitamin D utilization compared to those who were deficient, meaning that without magnesium, your D3 supplement may be largely wasted. Take 4,000 IU of D3, 200 micrograms of K2 in MK7 form, and 400 milligrams of magnesium glycinate, together with a meal that contains healthy fat, since D3 is fat-soluble and absorption drops significantly without it. Morning is the ideal time for this trio because D3 has mild stimulating effects on cellular activity that are better suited to daytime hours. Now that you have all 6 remedies, the natural question is, how do you actually put them together into a single daily routine that does not take over your life? That is exactly what I am going to show you next. I have arranged these into a precise morning, afternoon, and evening sequence that takes less than 10 minutes total across the entire day. And I will also tell you exactly what to watch for during the 6 to 12 weeks it typically takes for your enamel to show measurable improvement. Stay with me. The simplest way to rebuild your teeth that anyone can do. I know what you might be thinking right now. 6 remedies sounds like a lot to manage. So let me simplify the entire system into 3 moments of your day, each one taking no more than 3 minutes, and show you exactly how they stack together without overwhelming your routine. Your morning sets the biological foundation for everything else. Morning, D3, 4,000 IU, plus K2 MK7, 200 micrograms, plus magnesium glycinate, 400 milligrams. Take all 3 together with breakfast, and make sure that meal contains some form of healthy fat, whether that is eggs, avocado, olive oil, or full-fat yogurt. This is not optional. Vitamin D3 is fat-soluble, meaning your intestinal walls require dietary fat present in order to absorb it properly. Without fat, studies from the Journal of the Academy of Nutrition and Dietetics show that D3 absorption can drop by as much as 32%. The magnesium glycinate form is specifically recommended over magnesium oxide because glycinate binds more gently to the digestive system, which matters especially for older adults whose stomach acid production has already slowed. Take this once, with your first meal, and you are done for the morning. The afternoon is where your gum tissue gets its direct attention. Afternoon, warm turmeric salt rinse or green tea, honey soak. You do not need to do both every single day. Simply alternate between them, or choose whichever one you have ingredients for. The turmeric rinse takes 60 seconds to prepare and 90 seconds to use. The green tea soak requires only a cooled cup of brewed tea and 1 teaspoon of raw honey. Either way, this afternoon window targets the gum inflammation and bacterial load that accumulates through your day of eating and drinking. Curcumin from turmeric has been shown in a study published in the Journal of Indian Society of Periodontology to reduce gingival inflammation scores by 32% over 3 weeks of consistent afternoon use. Consistency here matters far more than which option you choose on any given day. Your evening routine is where the deepest repair happens, and the sequence of steps is critical. Evening: Nano-Hydroxyapatite toothpaste, then Xylitol rinse. Brush gently with Nano-Hydroxyapatite toothpaste for 2 full minutes, then spit without rinsing with water. This single step, leaving the paste to absorb overnight, is what allows the mineral particles to integrate into your enamel structure rather than simply coating the surface temporarily. Once the paste has settled for a few minutes, follow with your xylitol rinse. Dissolve 1 teaspoon in a small amount of warm water. Swish for 60 seconds, and do not eat or drink anything after. This order matters because xylitol creates the overnight bacterial environment that keeps Streptococcus mutans populations suppressed through all 8 hours of sleep. One important note before you begin. If you are currently taking blood-thinning medication such as warfarin, please speak with your doctor before starting K2, as vitamin K compounds can interact with anticoagulant therapy. Full remineralization typically requires 6 to 12 weeks of consistent daily use, so give your body the time it genuinely needs to rebuild from within. Your teeth are not failing you. Your body simply never received the right instructions. Every crack, every sensitive spot, every receding gum line is your body asking for minerals it has been missing for years. Now you know exactly what to give it. Start with just 1 remedy tonight, and build from there. Small and consistent always wins over perfect and abandoned. If this video helped you see your oral health differently, share it with someone you love who is quietly struggling with the same thing. I will see you in the next video, and I cannot wait to show you what comes next.